All, this is Dr. Mobeen Sayed from drbeen.com. Hopefully, you're doing good. I just wanted to tell you this very exciting thing that this morning, Dr. Zelenko had agreed to join us for a live talk. He is on the eastern side, he's in New York, so the time difference is 3 hours. So he had asked that if he could join us at 2 o'clock his time, which made it 11 o'clock my time. So my apologies that we could not talk at this time because it would have become late for him. So what I did was, this was a great talk. A few things that were interesting. I requested him to tell us, number one, what are his outpatient management protocols? And in this video's description, you would see a Zelenko protocol link. Plus, you would also see a Zelenko prophylaxis protocol link as well. I have also put the link to his Twitter profile. And if you go there, the post that he has pinned on his profile has all those links as well. The other thing that I had requested him was that if he could figure out or if he has seen other things other than hydroxychloroquine, and he talked about ivermectin as well. Plus, he talked about the other zinc ionophores, for example, quercetin or CG, the green tea's component. I keep forgetting the abbreviation for that. So please make sure that you watch that interview. It was exciting. It was interesting. And I want to clarify one thing. I received some of the messages from some of the cool beans. And it is a common thing that it's not necessary that every cool bean agrees with every topic that we discuss. However, I had received some messages that some folks said that they were not very happy with me to have, because of the political associations and leanings. And look, for me, when I started these discussions about COVID-19, I had made it a purpose at that time that when I'll come in front of you, if there is any issue with the topic's health or the topic's accuracy, that may be my problem. That may be I did not understand something well. That may be I did not present it correctly. But what I would do is I would not try to create an echo chamber in which you only listen to what are my opinions. So I wanted to make sure that anything that can save life, anything that can help us, wherever it is coming from, we should be able to look at that. So without any political leanings on my end, without any biases, I have my biases as a person. And so I have my political leanings as well. But this is something that we have to be above at this time. This is about humanity. This is about all of us together. It includes me, the discussions. It includes you. It includes our loved ones, and it includes the world. So at this time, I feel very strongly that putting ourselves into one corner may not be the right thing. So because of that, I am actually comfortable bringing in all those voices that may be pro something or against something, and to have their voice arrive to our cool beans. I am a vehicle who tries to bring things to you, and that is the basic purpose of it. The result of that is that if there is any chance somewhere by anyone who can offer an insight into how to protect ourselves, I would love to hear that. May that be a politically different camp, or a scientifically different camp, or a commercially different camp. I have never tried. For example, I talked about remdesivir. It is a big pharma thing. I talked about leronlimab. That is a small pharma thing. I talked about hydroxychloroquine. When there was so much opposition about hydroxychloroquine, I could have simply joined that bandwagon and took the leaning in one of the camps. But if you look at the topics that we have discussed, you would see that from my topics, you will not be able to say Mobeen is Republican or democratic or liberal or conservative or right or left, because that is not the purpose that we want to do. So I wanted to make sure that I come in live at this time, because we are used to seeing each other at 6 o'clock my time, PST. And I didn't want to miss this one, but we have done the lecture earlier. It's about 1 hour. It is a thorough discussion about hydroxychloroquine, about the Zelenko protocol, about the opposition that he saw, about the support that he saw, and about the work that he has done. And this work is done, as he mentioned, in South Korea as well. This work is done by French doctor, I hope I can pronounce his name correctly, Didi Rolle. So his work is there. He was the first one to actually come up with this study and say, this is what we have observed. He was the one to do hydroxychloroquine plus azithromycin. So credit where credit is due, but there are lots of opportunities for us to have inexpensive solutions. And that is what I wanted to bring to you. And I will keep doing that. And for that, I'm actually happy about this, that this is a place where we are all together, where you can trust me on this. I still make mistakes, but you can trust me on this, that if there is something that makes sense, then regardless of economy of that, or regardless of the scientific structure of that thing or political backing of it, I will try to bring it to you. So that is my promise to you. I think we are, even this morning when I was talking with Dr. Zelenko, the discussions he was doing, he was talking about hydroxychloroquine's mechanism of action. He was talking about quercetin's mechanism of action, presence of quercetin in various things. And I was thinking at that time that cool beans have been aware of this for about 4 months now. And we have talked about it again and again. And he talked about ivermectin, and I was happy that we had talked about it. He talked about budesonide, and I talked about Dr. Richard Bartlett, that he started this trend for the budesonide as well. And I was very happy that all those things that can make a difference are cool beans, know them in detail and in depth. I think that sometimes even more than some of the healthcare professionals, that we are aware of the things. So this is the this is the discussion for today, very brief discussion. In this video's description, there is the link to the previous interviews that I did this morning, YouTube and Facebook link as well, plus links to Dr. Zelenko's protocols and his Twitter account. Please follow him. Please see his messaging, see his treatment. And again, whatever is your own leaning, I respect that. But at this time, let's see how we can protect ourselves and our loved ones. So this is where we are at. We will see each other again tomorrow. Tomorrow we'll do the open forum. Day after, we'll continue with the inflammation part 2, where we'll talk about how do the cells, immune cells, arrive at the area of injury or infection, and what is the mechanism that does it. That mechanism kind of plays into the Rantes as well, and the leronlimab's mechanism of action as well. So it is actually important to look at that too. So this is where we are at. Any comments, and then let's break. But I just wanted to make sure that we understand, number one, we meet each other at the same time, plus I can offer what is in the back of my mind when I'm receiving guests. So there is a comment. Honestly, doctor, I'm no longer trusting CDC because it's controlled by the government. You speak truth, and I truly believe you made us aware of medicine that will eradicate this. Absolutely. And I am a learner with you. So I open up the books, I look at how the coronaviruses came in the past, how do they function, how do we take care of them, what had the previous times folks had done. So it's really, I am acting as a vehicle to bring things to you. And once again, if there are mistakes in it, if there are deficiencies in it, that is on me. I may have made a mistake while speaking about some mechanism. I may have overlooked something new that has been out there that I did not see. But whatever I try to bring, the intent and the purpose is to save us all, regardless of who we are. Thank you very much. So if we are cool, yes, Dr. Zelenko's interview was great. I loved it. You are correct, Mbal, that CDC, I am actually surprised at these bigger organizations that it seems like there is a hesitation to lead. There is a hesitation to stick your neck out and say, I think this is how we should move forward. And so they are looking for being followers. And if they are not in that state, then they are just lost. And I think the best advice that I can give to CDC or FDAs or WHOs is to go look in the books first, and then look into the past MERS and SARS-CoV-2 spreads, SARS-CoV-1 spreads, then look at how we manage those situations, and then apply them to this time. And then, very importantly, look at the doctors. There are two groups of doctors that are working on COVID-19. One group is general practitioners, internal medicine folks who are sitting in clinics, outpatient clinics, and managing. And then the second group is who are in the hospitals. The experience and the management protocols of the hospital are different from the experiences and management protocols of the outpatient. In this specific disease, outpatient management and aggressive management and early management is more important than ICU and hospitalization management. So unfortunately, what I'm seeing is the following. We are very much focused on the hospital state and ICU state, but we are not very careful. And by we, I'm saying WHOs and CDCs and the administrators. They're not very much focused on outpatient management. And there is one more thing. They're not very much focused on the long hauler. Long hauler is a phenomena. I'll tell you, I spoke with you a few days ago that one of my family patients whose father still has the problem even after 1 month of recovery, I called them once more last week, and they said the daughter also has chronic fatigue syndrome. So now a person with the cancer comorbidity has a long hauler state, and his daughter, I think 23, 24 years old, she also has a long hauler state. And so this is a very true state. This is something that is existing. And so far what I've seen is steroids or statins have been very, very much useful. Again, it also depends that what caused the long hauler. If it is just like Dr. Zelenko was talking today, if it is because of the severe organ damage, then that needs a different kind of approach. But if it is mildly symptomatic folks who are now just lingering in a long haul state, over there, immune modulation by steroids or by statins seems to be very effective. So this is where we are at. I just wanted to come in and talk with you. So thank you very much for joining. Tomorrow we'll work on the open forum discussions, and day after we'll continue with the inflammation. So thank you very much. Have a good day. Please click the links in the description to watch the actual interviews that we had this morning. Stay safe and happy. Bye-bye.